Learning muscles is hard work. Don't wait until the week of the exam to start learning these muscles. Start now. This slide gives you some advice on how to learn the muscles you're required to learn for this course. Use the materials in the laboratory to help you study and learn the muscles for both lecture and lab. Much like the bones, this takes time, so the biggest piece of advice is to start early. We will start by reviewing some of the muscles of the head. The frontalis muscle is the forehead. The origin is the gala aponeurotica. This is a flat tendon known as an aponeurosis. It inserts on the skin of the forehead. When the muscle contracts, the forehead will wrinkle and elevate the eyebrow. Orbicularis oris is a circular muscle that surrounds the lips. Its origin is the mandible and maxilla, and the insertion is the lips. When this muscle contracts, it presses against the lips and teeth. It protrudes the lips during speech and kissing. Temporalis is on the side of the head near the temporal bone. It originates on the temporal bone and inserts on the mandible. When it contracts, it will elevate the mandible. This is a chewing muscle or a muscle of mastication. Sternocleidomastoid has its origin on the sternum and the clavicle and its insertion on the mastoid process of the temporal bone. When both sides of the muscle contracts, it flexes the head, meaning you look down towards your feet. If only one side contracts, your head will flex toward the side that is contracting and you will look toward the opposite side. The masseter muscle originates on the zygomatic arch and inserts on the mandible. When the masseter contracts, it elevates the mandible. The masseter is another muscle of mastication, just like the temporalis muscle mentioned earlier. Moving on to the muscles of the upper trunk. The pectoralis major is a convergent muscle. Recall, this means it has a broad origin and a single insertion point. The origins of pectoralis major are on the clavicle and the costal cartilages of the sternum. It is inserted into the intertrabecular groove on the humerus. This is the depression between the greater and lesser tubercle. When this muscle contracts, it causes flexion, adduction, and medial rotation of the humerus. When you hug someone, you are using the pectoralis major muscle. The deltoid muscle forms the cap of the shoulder. It originates on the clavicle and spine of the scapula, and it inserts on the deltoid tuberosity, which is the roughened bump on the anterior lateral surface of the humerus. When deltoid contracts, it abducts the shoulder. This means you're moving your arm away from the midline of your body. The external intercostal muscles are toward the surface of the body between the ribs. They are not visible in this image. They originate on the inferior border of the upper rib, and they insert on the superior border of the lower rib. These are the muscles of respiration. When they contract, they elevate the rib cage, allowing air to enter the lungs. We will learn more about how this muscle is involved in respiration in A&P 2. The latissimus dorsi is on the posterior part of the lower to upper trunk. This muscle has a complex origin, which includes the midline of the lower back, the lumbodorsal fascia, the spinous process of the lower thoracic and lumbar vertebrae, as well as the lower ribs. In this image, the trapezius is overlapping latissimus dorsi to some degree. The latissimus dorsi inserts on the intertrabecular groove in the humerus below the insertion point of pectoralis major. When this muscle contracts, it extends, adducts, and medially rotates the humerus. The latissimus dorsi is usually well developed in swimmers because they must extend their arm against the resistance of the water, and so this causes the muscle to increase in size. The trapezius is the trapezoid-shaped muscle on the posterior part of the upper trunk. It also has a complex origin which includes the midline of the back of the neck and back, occipital bone, the ligamentum nuchae, and the spinous processes of the thoracic vertebrae. The trapezius inserts on the clavicle and scapula, specifically the spine and acromion process. There are several nerves that supply this very large muscle. Depending on which nerves are activated, there are a variety of actions this muscle can perform. Contraction will extend the head, elevate or depress the scapula, rotate the scapula, and elevate the clavicle. When you extend your head, shrug your shoulders, depress your shoulders, and move the scapula to the midline of the body, you are using various portions of this muscle. There are 4 muscles that make up the rotator cuff. The first is supraspinatus. This muscle is above the spine of the scapula. It originates on the posterior surface of the scapula and inserts in the greater tubercle of the humerus. Contraction of this muscle causes abduction of the humerus, meaning you move your arm laterally, similar to the action of the deltoid muscle. The second muscle of the rotator cuff is infraspinatus. This muscle is below the spine of the scapula. It originates on the posterior surface of the scapula and inserts on the greater tubercle of the humerus. When this muscle contracts, it causes lateral rotation of the humerus. The third muscle is teres minor. This muscle originates on the lateral border of the scapula and inserts into the greater tubercle of the humerus. When this muscle contracts, it also causes lateral rotation of the humerus. The fourth and final muscle that makes up the rotator cuff is subscapularis. This muscle originates on the anterior surface of the scapula and inserts on the lesser tubercle of the humerus. Because this muscle is on the anterior portion of the scapula, when it contracts, it causes medial rotation of the humerus. Next are the abdominal muscles. The first one that we're going to discuss is the external abdominal oblique. Oblique means the fibers run at an angle, and external means that it's toward the surface of the abdomen. This muscle originates on the lower ribs and inserts on the linea alba. When both sides of this muscle contract at the same time, it flexes the vertebral column. If only one side is contracted, your abdomen will flex to move in the direction of muscle contraction. Next up is the rectus abdominis muscle. Rectus means the fibers run straight up and down. The rectus abdominis originates on the pubic bone and inserts on the xiphoid process of the sternum and costal cartilage of the lower ribs. It is divided by the linea alba. When the rectus abdominis contracts, it flexes the vertebral column. It also helps to support and compress the abdominal viscera. When the rectus abdominis muscle contracts, it will increase abdominal pressure. This is important for such functions as urination, defecation, vomiting, and childbirth.